All right, guys, as I said, our whole goal is to nail everything up to the ear. The rest of the stuff's kind of just little picky stuff that I'm going to show you some mnemonics or quick ways to remember it. It's not high yield stuff. So if you're worried, if you're like a week before the test, you can just stop the video now and go to other sections. This is kind of like brownie or extra credit type stuff to make things a little easier for you. Again, some of the stuff like temporomandibular joint that's left in this lecture is a big deal, right? But that's going to be covered already in dental anatomy and occlusion. The tongue is on here, no fungiform papilla. That's also covered in oral histology, things like that. But I'll kind of reinforce the key concepts now just to make sure you got it, but this is low yield stuff. So I'm going to start with the infratemporal fossa, okay? The contents of the infratemporal fossa have been hit very rarely. Let me show you a test question that kind of reinforced that. So the key thing there to know is that the V2 is going to be in the pterygopalatine fossa, which is on the next page. So I would just kind of look at that V3 infratemporal, V2 is going to be pterygopalatine fossa. So as we get into the nasal cavity, look at the heading that says openings into the nasal cavity. You're going to see there we talk about the middle meatus, the infundibulum. Everybody see that? It's been rarely asked, but they want you to occasionally know that that leads into the frontal sinus. So just draw an arrow here from infundibulum over to frontal sinus and take a look at that. On the next page, semilunar hiatus, right? It's talking about how the frontal sinus and the maxillary sinus open into that. That's been another thing that's been really rare. So it's really been, when it comes to the sinus, is about the nasal cavity, about the sinuses a little bit. So you can hone in on, again, that the semilunar hiatus has the frontal sinus and maxillary sinus emptying into it. As we get into the blood supply to the nasal cavity, that Kisselbach's plexus is something you can kind of pay attention to quickly. Let me show up here a mnemonic that I use for this. Again, not high yield, but in case they ask, look at this with me. The phrase that I use is you have to face, like imagine you're someone who has really ugly legs. You have to face your legs. So face, like you have to face it, the fact you have bad legs. So the face would be the first one, facial artery, right? And then in addition to that, you're going to have legs, L-E-G-S, right? So the L would be labial artery, ethmoid artery, greater palatine, and sphenopalatine artery, okay? So you can face your legs. You can use that if you'd like. The key thing on why this might be asked is this is what can lead to nosebleeds. And so very rarely they've kind of tied that in and wanted you to know that fact. All right, guys, the next thing we're going to hit is underneath paranasal sinuses. Go straight to maxilla, okay? This is the one that if they're going to hit would most likely be it. It says it's the largest of the paranasal sinuses. It drains, as it says, into the middle meatus by way of the semilunar hiatus, okay? That's one you want to pay attention to. You guys are going to notice in the colder months, a lot more of your patients are going to come in with sinus infections, right? They're going to affect the maxillary teeth. They're going to complain of that. And the semilunar hiatus is something you want to kind of highlight there in your notes in case they ask it. All right, guys, now we're going to look at the muscles of the head and the face. Take a look at this visual with me. I'm going to show you kind of the actions of the muscles through this visual to make it simple for you. As you know, all of these muscles are going to be innervated by cranial nerve 7, the facial nerve. The frontalis muscle, this first one, is going to elevate the forehead. Next one, depressor anguli oris muscle, is going to take the angle of the mouth here and move it inferior and lateral. The next one, the levator labii superioris muscle, is going to raise the angle of the mouth. The next one, the risorius muscle, is going to pull the angle of the mouth lateral and a little bit up. The next one, the depressor labii inferioris muscle, is going to take the bottom lip and move it down and slightly lateral. The mentalis muscle is going to raise the base of the lower lip. The orbicularis oris muscle, the key thing is that it functions in puckering the lips. The nasalis muscle is going to close the nasal openings. The zygomaticus major muscle is going to take the corner of the mouth and move it superior laterally when you smile. That's a key one to know. The zygomaticus minor muscle is going to elevate the upper lip. The buccinator is going to move the cheeks against the molar teeth during chewing. The orbicularis oculi is going to close the eyes, whereas the levator is going to open the eyes. Guys, those are the key things I kind of pay attention to just quickly as you skim through those muscles. All right, guys, let's look at the arteries in the head and the neck, and let me show you a visual to kind of make this really clear. When you think about the aorta, you want to think about three branches that come off the Aorta. You want to think of the aorta as the ABCs. The aorta is the A, the B is the brachiocephalic trunk, which is going to go to the right side. The C, common carotid, and the S, subclavian, are both going to go to the left side, okay? And as it says here, the right common carotid artery begins at the bifurcation of the brachiocephalic trunk. Just behind, pay attention to this, to the right sternoclavicle joint. Could be picky, but I would definitely know if, at the very least, that on the right side, you're going to have the brachiocephalic trunk. Right on the left side, you're going to have the common carotid and the subclavian. Okay? As it says here underneath left common carotid artery, just a reminder from something we talked about earlier. It says each common carotid artery ascends into the neck at the level of the superior border of the thyroid cartilage. That's when it's going to divide. Okay? The superior border of the thyroid cartilage, that's something we talked about earlier. I just want to reinforce it in the notes. As we get into the external carotid artery, let me show you a basic test question that was asked in the past. So sometimes the questions are just as simple as knowing what are branches of what arteries. The other one I would look at just quickly is the maxillary artery. Let me show you a past test question on this. As we get into the veins of the neck, guys, the questions on here have been pretty basic in the past. The biggest thing I'd want you to know is what we talked about earlier, how the sigmoid sinus, right, becomes what? Do you remember? The sigmoid sinus, all roads lead to the sigmoid sinus, right? Then it becomes the internal jugular vein. I would go to your notes there and just kind of pause on the internal jugular vein for a second, skim the key points on that. But the biggest by far to know is that the sigmoid sinus becomes the internal jugular vein. That's what I'd pay attention to. And while we're on the internal jugular vein, when you think about all the things that go into the internal jugular vein, this is a mnemonic that some people like that might help you kind of really get these key points down quickly. So you can organize it this way. Med schools let fun people in. So you can look at that quickly and make sure you got it. Middle thyroid, superior thyroid, lingual vein, facial vein, pharyngeal vein, inferior petrosal sinus. Those are the key things there that go into the internal jugular vein. Not super high yield, but in case they ask something on it, because the internal jugular vein would be kind of the hottest topic here in terms of veins of the neck. They did ask one question in the past, one that I could find on retromandibular vein. So take a look at this to kind of get the key concept there. All right, guys, let's talk about the lips for a second. There's not a lot here at all that I'd pay attention to. There's just a bolded couple sentences that talk about how you don't have hair follicles. There's no sebaceous or sweat glands, so lips will chap easier than other parts of the body because of that fact. So just kind of skim that quickly. Okay, guys, now we're going to talk about the palate just really quickly. A couple key things from your notes. As you look down here, you can see the hard palate is made up of three bones, the maxilla and the paired palatine bones, right? So you're going to be the greater palatine and the lesser palatine. That's what you're looking at there. As you get into this, the incisive foramen, it transmits a nerve and an artery there. Nasopalatine nerve, sphenopalatine artery. That has been asked in the past, very rarely, but hone in on that. The greater palatine and the lesser palatine are going to take what you would think. Greater palatine arteries and nerves, lesser palatine arteries and nerves. The greater palatine nerve, just kind of hone in on that for just a second. That's going to provide from sensory, right, from the maxillary nerve. So the sensory to that area is going to be from the maxillary nerve, and it's going to be transmitted through this greater palatine nerve. Kind of picky, but that's just something to kind of hone in on if you want to really know like every detail. The other thing I would say is that the greater palatine nerve also takes parasympathetic fibers. So two things, the sensory and also parasympathetic, and it's getting that parasympathetic from the pterygopalatine ganglion that we mentioned earlier. Okay, so that's kind of some quick things I would pay attention to. The next thing I would hone in on is looking at the soft palate for a minute. As you can see here, it says during swallowing, the soft palate moves posteriorly against the wall of the pharynx, preventing regurgitation, okay, when you swallow. That's the key important function, stops regurgitation. That's the soft palate. When you get into the muscles here of the soft palate, there's a few I would pay attention to. The levator villi palatini, I would know that it elevates the soft palate. Everybody see that? It's innervated by cranial nerve 10. Whereas the tensor villi palatini is going to tense the palate, makes sense, not elevate it, and it's going to be innervated by cranial nerve V3. Okay, look at those kind of two details about innervation. If you're going to summarize this just really fast, I would be going through these quickly and looking at function and innervation. Palatoglossus, that's the big one we talked about earlier. That's on the side of the tongue, right? And it's not going to be innervated by cranial nerve 12. That's the big unique one that has a different innervation. So kind of hone in on that. And these last two, the palatopharyngeus muscle and the musculus uvulae, are both innervated by the vagus nerve, right? The pharyngeal plexus of vagus. Remember on the test, if you don't know the answer, you always pick vagus. All right, guys, as you look at the tongue, there's two big things I want to point out. The first one is going to be that fungiform papilla is what's going to have the taste buds, going to be innervated by the lingual nerve, right, that combines with the chorda tympani nerve that we've talked about many times. Hone in on that. The other thing I want to pay attention to is what innervates the muscles of the tongue. You already know that's going to be cranial nerve 12 with the exception of the palatoglossus, which is innervated by cranial nerve 10. Those are kind of the few little details I would pay attention to. But really, the tongue is going to be reviewed well for you in terms of the details in oral histology. So when you get to that portion of the oral histology video, pay attention. But the functions of the tongue right here are a little bit more specific to this section too. So you can kind of glance at those and make sure you have those major functions down. All right, guys, the next section that we're looking at is the pharynx, and this is one that I really wouldn't look at. You can pause and skim if you want, but I would just move on with your life. Not very much high yield material there at all. Again, all of this is kind of like lower yield material. But the next thing we want to talk about is the salivary glands, just briefly. The key things here we've already talked about, which is the innervation of them. But if you have some extra time or if you're just wanting to demolish the little extra details, if you're more the type A person, definitely pay attention to where they're located. So for example, if you look here at the parotid glands, located between the mandible and the sternocleidomastoid muscle. That could be a little fact I would pay attention to. You guys know when it gets to nerves of the parotid gland, the innervation, you know that's cranial nerve 9 through the inferior salivatory nucleus, through the lesser petrosal nerve to the otic ganglion. Boom, right? Remember that. We're all over that. We know that well. The submandibular glands, as it says here, are shaped along the body of the mandible and a little bit deep to the mylohyoid muscle. That's something that is a little detail that you could pay attention to. You guys know it's going to get its innervation from the chorda tympani nerve through the lingual nerve, right? Just like the sublingual glands, okay? So those things are mentioned there for you just to review. The next section is the temporomandibular joint, very important, but we have a whole section of the text, dental anatomy and occlusion, just devoted to that. So if you want to skim through these are fine, but really I would focus all my attention on the dental anatomy and occlusion portion of that because everything is covered there. All right, guys, now we're going to talk about the neck just real fast. Two things I want you to know. Number one is I would know what the carotid sheath is. Let me show you a past test question on this. As you can see in the heading of our book, there are 4 things that go through the carotid sheath. Here's a dumb little mnemonic that I made up that might help you. Number one, I think of Anna, like Anna as a person. Anna went to Vegas in Jug's car. Think of Jug as a person's name if you want. Anna is ansa cervicalis, vagus, vagus nerve, in Jug's internal jugular car, carotid, okay? Those are the 4 things that go through the carotid sheath. That has been hit actually a couple times, so it's something you can quickly look at and make sure you have that down for the test. All right, guys, the next thing that's been hit a couple times on old tests is the different triangles, okay? The posterior and anterior cervical triangles. So if you have the time to look at this, great. You know, the key thing is the sternocleidomastoid muscle is going to be the boundary that differentiates those two. So like for the posterior triangle, it's going to be sternocleidomastoid and the trapezius are going to be the boundaries of it. So you can kind of pause and skim through these quickly. Here's some old test questions that kind of force you to dig a little bit deeper if you want to dig deeper. I found that either the questions are super easy on this or they're super hard and really detailed. So if you want to try and get every question right, kind of pause the video and look at these next 2 pages and dig in a little bit deeper. But here's some things I've found and kind of organized for you in terms of past test questions. All right, guys, last but not least is the arteries and veins in the root of the neck. I want to point out just a few quick things. Some of this is already just kind of review for you, but I want to make sure you have this down. If you look in your notes here, you're going to see, remember the brachiocephalic trunk, again, is going to be on the right side. The common carotid and the subclavian is going to be on the left. Sometimes they've wanted you to know what are the branches of the subclavian artery. So take a look at this and see how you would do on this test question. If you're thinking, there's no way I'm ever going to remember that, that's okay. Here's kind of a quick little mnemonic that some people like that help you remember the key points on this. So the phrase is TV, like television, TV is cost driven. TV is cost driven. Those are going to be your 5 branches of the vertebral artery. All right, guys, as we get into veins of the neck, I want to go straight to subclavian vein here in your notes. Glance at this with me. It says there has a bicuspid valve near its termination. That's picky, but occasionally that's been asked. I would also know internal jugular vein. It says there is enclosed in the carotid sheath, right? So we just talked about that. That's something I would highlight. In terms of nerves in the root of the neck, we're almost done here, guys. The vagus nerve, parasympathetic. You guys know that, right? To the thorax and the abdomen. You know it's enclosed in the carotid sheath there again. That's big. And here it is again, the recurrent laryngeal nerve. Hopefully that's kind of in your head now. If it's not, that's going to be a branch of the vagus, remember? And we said it does different things on the right and left side. We said the right side here loops around the subclavian, left side around the aorta. That's kind of the key things you want to pay attention to on that. When you go to the sympathetic trunks, the key thing you want to pay attention there again is the superior cervical ganglion. As you look there in your notes, you can see it's located at the level of the atlas and axis. That's not something I mentioned before, but if you're having like an all-star day, C1 and C2, right? We said it's right here at the angle of the mandible. We said once the fibers synapse there, they're now postganglionic from that moment forward. If you look at the heading that says lymphatics in the root of the neck, you want to pay attention to the thoracic duct there just briefly. Make sure you know it's on the left side. That's what it says. Enters the left brachiocephalic vein, right? That's the key thing I would pay attention to that could show up on the test question. It says drains lymph from the entire body, right, except the right side of the head and neck. So it's a big portion. The entire side of the body, especially on that left side, is what I'd pay attention to. The thyroid gland and all the rest of this now moves into the body, gross anatomy of the body, which we said at the beginning. As we've looked at all the old test questions, like 95% or higher is all on the head and the neck. So we wanted to really nail those sections, guys. I hope you feel awesome about gross anatomy. You can absolutely do this. Some of the details, if you felt like, man, that was a lot, or there's a lot of details there that's going to be hard for you, the one thing I would encourage you just to keep remembering about a standardized test like this is what allows you to nail a test like this is not being unbelievably good just in one section, okay? It's being balanced. It's having really good balance in the key sections that matter, right? So you guys know that there are 5 sections that really matter in a major way on this test, the big 5. And so what you want to do is focus on those big 5 and try not to be awful in any of them. I know that doesn't sound very inspiring, but the reality is sometimes I'll have a student that just gets obsessed with one section and they'll keep digging and knowing every detail about it. And let's say they've got like 2 months before their test and they start with gross anatomy and they start digging and digging into the details to a point where they spend like literally like 3 weeks on gross anatomy or 2 full weeks on gross anatomy, like all this time on gross anatomy. And then they start to stress because the test is coming up and now they start to spend time in all these other sections and have to feel like they're memorizing, and then they don't get to go back and look at gross anatomy at all before the test, and all that stuff they spent on the front end is now they're forgetting, right? So the one thing I want to encourage you about is it's normal not to feel like you're going to know every detail in every section. The key thing is to be balanced and to say, you know what, if I'm really bad at any of the big 5, like awful at any of the big 5, your focus right now is to become solid as fast as possible. And what I mean by solid is even if you're at like a C range, like 75%, that's okay, because the reality is you'll have other sections that will push you even higher and will make it so that you're not even close to failing. The people who fail a standardized test like this are people that have multiple areas within the big 5, like gross anatomy and biochem, let's say, where they're at like a D or F level, and then it really pulls things down. So right now it's like a goal in your mind, like a race to get solid in the main sections, and don't freak out if you're not an all-star, because what will get you through this test is being balanced in the key sections, okay? So keep pushing, guys. Go to the next section and let's keep rocking and rolling together.